bradycardia and the voltage ECG voltage যদি হয় low voltage, then what will be the diagnosis? When there is bradycardia and the ECG tracing is low voltage, then the diagnosis will be hypothyroidism. So look very carefully here. Tachycardia, low voltage or low volume, low voltage of course, sorry. Then the diagnosis is pericardial effusion. If there is bradycardia and low voltage, then diagnosis will be hypothyroidism. And if there is tachycardia and high voltage ECG, then this will be thyrotoxicosis. Okay. So this is the finding of pericardial effusion. Now come to the cardiac tamponade. In cardiac tamponade, there will be also tachycardia of course, tachycardia. Another important finding you should remember always, that is electrical alternans. What is electrical alternans? Mind it and look carefully. Heart remain inside fluid in case of cardiac tamponade, and heart is pumping, and with each contraction heart move from side to side and anteriorly and posteriorly. That is, heart become very unstable, and while heart move a little bit from side to side or anywhere else within the fluid, that is fluid in the pericardial cavity, then the electrical axis change with each motion of the heart. So electrical alternance occurs. That is, in ECG tracing we will find one strong beat followed by one weak beat, then one strong beat, then followed by one weak beat, then a strong beat, then weak beat, and so on. So this is the called electrical alternance. Okay. Now come to chest X-ray. Okay. Again pericarditis, pericardial effusion and cardiac tamponade. ECG, sorry, chest X-ray. যদি আমরা X-ray করি তাহলে in case of pericarditis X-ray will be quite normal. In pericardial effusion the X-ray finding will be cardiomegaly, and there is globular heart shadow, globular heart shadow. This is also called water bottle shape heart. So cardiomegaly ek number 2, globular heart shape shadow. Sorry. So in case of pericardial effusion the finding is this, and in case of cardiac tamponade the finding will be the same as in case of pericardial effusion. Okay. Of course there will be another important finding in pericardial effusion or cardiac tamponade, the oligemic lung field. What do you mean by oligemic lung field? Oligemic lung field means the bronchovascular marking, that is vascular marking in the lung field will be minimum. That is called oligemic lung field. And plethoric lung field, another term, opposite term. In case of plethoric lung field, the vascular marking of the lung field will be increased. So in pericardial effusion or cardiac tamponade, the X-ray finding will be oligemic lung field as well as cardiomegaly with globular shape cardiac shadow. Now ECG, echo. This is the last one, echo. In pericarditis, the echo finding will be quite normal. In pericardial effusion, the important finding, the ecologist will comment on their report, echo-free zone, echo-free zone. In cardiac tamponade, of course, there will be echo-free zone. The echo-free zone means when in case of ultrasonography and echocardiography is the same modality, machine and the same physics in both cases. When there is any collection of clear fluid, there will be no echo. In case of clear fluid like water, blood or something else, pus, clear fluid, there will be no echo. So this is called echo-free zone. It is also called, this echo-free zone also called anechoic, anechoic. So in cardiac tamponade also there will be echo-free zone. But how to differentiate between pericardial effusion and cardiac tamponade? In cardiac tamponade, the ecologist will try to notice that there will be a paradoxical movement of ventricle during diastole. In case of cardiac tamponade, there will be paradoxical movement of the ventricle during diastole. Please try to understand. During diastole, this is the heart, say this is the heart. During diastole, the ventricle become relaxed and ventricle try to go outward. And at the very beginning of the diastole, the ventricle try to be relaxed, try to go outward side, be relaxed, try to be relaxed. But as the heart being compressed by fluid outside the heart, the ventricle at the very beginning of the diastole try to go outerward, but suddenly goes inward. So at first go outward during diastole, at the very beginning it goes outwards, then suddenly it goes inward. So this is called paradoxical movement of the ventricle, inward during diastole. The very important finding in echocardiography, and by this finding we usually differentiate clinical by echo pericardial effusion from cardiac tamponade. So time going on, I stop this lecture here. Okay, thank you very much.